I'd say since the midterm evaluation, I have improved my health assessment techniques across the lifespan by adapting a more systematic and holistic approach. I now consider developmental, physical, and psychosocial factors for patients of all ages. Additionally, I have strengthened my skills in using evidence based assessment tools by recognizing subtle clinical changes. For example, now I perform focused assessments to identify early dehydration in older adults, allowing time for timely interventions. And two, I'd say my ability to differentiate normal variations or variations of normal and abnormal findings has improved through practice and feedback. I can now identify subtle deviations that may indicate pathology rather than assuming all variations are abnormal. For example, I'd say during a recent assessment, I observed um, a mild bilateral ankle edema in a patient with hypertension and recognized that as an early sign of fluid retention, um, which prompted for further evaluation and medication adjustment, which preventing a potential heart failure exacerbation. And then for question three, I'd say I have demonstrated the nurse's role in health promotion by educating patients on lifestyle changes and vaccinations and routine screenings. I'd say I have counseled a middle-aged patient, which was pre-diabetes, on diet, exercise, and glucose monitoring. My guidance led to improved blood sugar control over a couple visits and illustrating the impact of preventative nursing interventions on patient outcomes. For question four, I'd say I applied primary prevention strategies by providing smoking cessation education for adults at risk for cardiovascular disease. This involved assessing readiness to change, setting achievable goals, and providing follow up resources. This experience deepened my understanding of primary and secondary and tertiary prevention and how tailored interventions can benefit individuals and communities. And for question five, I say I have learned to adapt assessments and interventions for special populations, including older adults, patients with chronic conditions, and culturally diverse groups. For example, I worked with the older adult in a community clinic, modifying physical assessments for mobility limitations and providing fall prevention education. This reinforced the importance of individualized care plans to promote health and prevent complications in vulnerable populations. And for number six, I'd say since the midterm, my skills have in conducting comprehensive assessments, including like nutritional, physical, and psychosocial dimensions, have improved. I now incorporate targeted questions and objective measures to gather and complete patient data. For example, combining a detailed dietary history with psychosocial screening help identify risk factors for malnutrition and depression, allowing for a holistic care plan. And then for number seven, I'd say health assessment documentation. I have considered my documentation competency strong, considering consistently meeting legal and professional standards. I use organized templates. I review entries for accuracy. Um, I use clear, objective language. Over time, my documentation practices have evolved to ensure timely, accurate, and professional records.